Did you know that in Massachusetts, 2 out of 3 adults and 1 in 3 children are overweight or obese? That almost half of the adults in Massachusetts do not get the recommended amount of physical activity. Welcome to Building Community. I'm your host, Donna Rodriguez. In this episode, we're going to explore the connection between individual health and community health, how to assess the physical health of our communities, and initiatives already in motion in our area to make the healthy choice the easy choice. I'm joined by 2 guests who have not only made healthcare their lives' work, but have been part of a unique collaboration to improve the health of our communities and provide us the tools to enrich our lives through better health. Peter Holden, the President and CEO of Beth Israel Deaconess Hospital, Plymouth, and Matt Muratore, Plymouth Selectmen and Administrator at Plymouth Rehabilitation and Healthcare Center. Welcome, gentlemen.
Thanks.
Thank you so much for being here today.
Thank you for having us.
Now, those numbers are pretty horrifying, and that's just the start of the story. Tell me what we're actually seeing with the physical health of us as a community and as a nation.
The numbers are staggering, and they're going up every year. So I would start with, I would characterize it as a crisis in healthcare in the whole country, and that the cost of healthcare is going up at what I would say is an unsustainable rate. And it's putting the fiscal health of the entire country at risk. Now, we have a chart that I'd like to show, and I promise it's the only one, but I think it frames it very well. We have the most expensive healthcare system in the world, and Massachusetts is the most expensive healthcare system within the country.
Why is that?
Well, the question is, do you get value for what you're spending, and what are the drivers of that high cost? And there's a lot of analysis, a lot of study, but I believe one of the most significant drivers of that are what we sort of refer to as self-inflicted wounds. They're a result of the lifestyle choices that we as individuals make through our lives. What we eat, how much physical activity we do on a daily basis, whether or not we smoke, and whether or not there's any kind of substance abuse or behavioral health issues, etc. And I would say lifestyle choices are things that we can influence. I would venture to say that on any given day, 50 to 60% of the people that are in acute care hospitals in the Commonwealth are there as a result of one of those or more of those lifestyle choices. We simply can't afford that. So what we're trying to do as a healthcare profession is say, we've been going at this the wrong way. What we've been essentially is a fix-it shop, where you sort of do what you want, and you come to us in your 60s or whatever, and we can replace anything that's worn out. Any joints, any organs, just about everything but the brain. We'll take it out, we'll give you a new one, and you're good for another 50,000 miles. That's the most expensive way to take care of people's health. What we're trying to do now is we realize if we can have you lead a healthier life longer, maybe you don't need the quintuple or quadruple bypass. Maybe you don't need all the hip and knee and joint replacements. And your annual consumption of procedures and tests and hospitalizations should go down. So I used to want to run the hospital that did the best bypass. Well, I've got 4 teenage boys. I don't want them to need the bypasses in the future. So I want to make it easier for them to eat healthy, easier for them to get physical exercise, and easier for them to live in an area that encourages that.
One of the things that, to go along with what Peter's saying, that we're seeing in the nursing home industry is we're seeing a younger population coming to us now. As Peter's saying, we're seeing the people with the knees and the hips that are coming to us that are in their 50s and 60s now. And we've got people that are living, that go home. But then what happens is you've got people that come to us that are living for the rest of their lives in their 50s and 60s in the nursing home because of all the unhealthy choices they've made over their lifetime.
So it's not just, it's being proactive individually, but what can we do collectively as a community to make it easier for people to make the healthy choices?
Exactly.
If you just look at obesity and overweight all by itself, our kids right now are going to have the highest, we predict, they will have the highest rate of diabetes of any generation in history. The kids that are in grammar school right now, for the first time in U.S. history, have a lesser life expectancy than their parents. I think that's shocking.
It's
I think that is horrific, and we need to deal with that. Diabetes costs us about $3.5 billion a year in the Commonwealth every year. That's where a significant portion of what we shouldn't be spending in healthcare can be saved. It's what you eat, it's how much you exercise, and it's making that easy for the kids that we need to be focusing on, and not just sort of say, well, it's okay, they'll grow out of it, you know, when they have their growth spurt. Because the obesity and the overweight rates continue
It's not changing.
Through to adulthood. And we can't afford that. And it's wrong.
Now, in 2007, one of the things that the governor did in Massachusetts was to start a project called Mass in Motion that really helps communities to become health leaders and look at the community and be able to truly, instead of maybe talking about the individual issues we see, take a step back, look at the big picture and really assess our health and what are we doing to help to encourage individual health. Can you talk a little bit about that process? What do we need to look at when we're evaluating where do we stand, what are our issues, and what are the things that we can do to improve health for the overall?
I'll take a stab at it. The hospital every 3 years has to do what we call a community health assessment. So it's public health indicators, it's acute care indicators, it's a snapshot of at any point in time of the health care of the population that resides in your area. And what came up is no secret. It was obesity, it was heart failure, cancer, substance abuse. It's all the things that we know, you know, obesity being one of them. So as we're evolving in the healthcare industry on the things that we should be working on, which is prevention and wellness and helping people lead healthier lifestyles, we convened a summit. And we probably got, I think, maybe 150 community leaders together. And it's what can we do to begin to energize and channel the community efforts in some ways that will pay off and help us move that needle on the health of the population. Out of that came the Healthy Plymouth Initiative, and we applied for the Mass in Motion grant. We received it, and we organized an effort. We had tremendous volunteers. I mean, we were very fortunate in that we've got a school system that cares. We have town government that cares, and it was talk about any willing individual. And we put together task forces around what we call complete streets, healthy nutrition, safe routes to school, and smoking cessation, and came up with programs around each one of those to begin to model programs in the community to again begin to get it into the lifestyle, begin to make it sort of the way we live. If you have to make a conscious decision every day about am I going to exercise or am I going to, you know, eat the banana as opposed to the Twinkies, and you know, it just needs to be easier. And so that's what we're trying to do is to sort of we've changed the menus in the schools. Gary Maestas and his team over there have been wonderful partners in trying to make it easy for kids to have good meals, good choices. The kids have helped us prepare different menus. You know, this is better than that. And, you know, you can't tell a child that you need to eat this because it's healthier for you than that, because then, of course, they won't even look at it.
They're going to go to the other.
Yeah. So
I would think on the town side of that, you know, people kept saying, well, why do we want to get involved with this? And it was Lee Hartman and Andrew Holloran that were working together. And I think with my healthcare background and being a selectman and chairman at the time, I said, well, let's go just check it out. And I started to explain to some of the people like Mark Garrett, JB, the DPW director, and people like that, let's just come and listen and see what we can do. And then I remember that meeting at the hospital we had with Mark Fenton, and after he spoke, there was so much excitement around that room afterwards by the people that work in the town, and the ideas just started flowing from there. It was
Because
magnificent to see.
there really are things that a town can
Absolutely.
do when you look at the physical makeup of your community. Things like complete streets. And for folks who aren't familiar with that, could you explain what complete streets
Sure.
is?
I mean, if folks go to Oberry Street, where the hospital is off of, that street was done about a year after we had this. And what it is, it's redoing the street from sidewalk to sidewalk, and you put in a bicycle lane so that people can actually ride their bikes down it. The Board of Selectmen actually adopted a policy about 2.5 years ago that any street that is redone now will have those complete streets.
And we're starting to see it throughout our town. So
Absolutely.
they're easier for people to walk to the store, to their neighbors, for children to be able to walk, a safe place for people to bicycle, so cars are used to seeing them, and also room for cars. But there are other things that have been being done as well. When you look at parks and recreation, making sure open spaces are clean, that they're safe.
Walking trails, everything.
We want to make it a community where people enjoy going outside.
Yeah, look at we're a tourist destination. It's become clear that that's our #1 industry right now. And what a better way to get tourists in here by mapping out all the trails where people can actually go. And we're starting to see people come because of the walking trails and the bike trails that we have here.
And by also being able to advertise that and make that known to people who live in the community, they're more likely to go out and to start to look at some of the things.
Exactly.
Now, with also with recreational space and community centers, there's been so much work in this area looking at taking care of the community centers we have, recovering some, and looking to build more. So there are places for children to go after school as well.
And you have to connect them. So if you're going to build 23-bedroom family houses on a cul-de-sac someplace, make sure that there are trails that the kids can walk and bike to get to, schools and other neighborhoods, etc. Because when you take away the sidewalks and when you put those cul-de-sacs off main roads, all you're doing is making mom and dad chauffeurs. Because they look at the heavy traffic and it's like, I don't want the kids riding a bicycle or walking out there. So if you think ahead and you make those connections, all of a sudden the kids are getting out, nobody's worried. There's not a bad guy hiding behind every rock in Plymouth. I mean, it's a wonderful place to live. It's a very safe community, and we want our citizens to be able to take advantage of that.
And we want to create free-range children who can be out, who can be enjoying their community, and who can be growing up in a community that they can move and can exercise and be healthy.
Yeah. When I was a kid, you got thrown out of the house Saturday morning at 7 o'clock, and it was don't come home until the street lights come on.
Right.
Until dinner time.
And if you don't do that, we might not miss you anyhow. So, it's okay.
And when you had practice, whether it was baseball or football, you rode your bike to it.
Exactly.
You didn't get dropped off and picked up. And if it was rain, didn't matter what the weather was like. That's what you did.
And everybody enjoyed it. Now we're starting to sound like all of those comedy routines. So I walked to school 3 miles. And on that note, I think we'll take a brief break, and we'll be right back to talk a little bit more about what can we do to increase the health of all of our communities. Thank you for joining us on Building Community.
Kicking off an exciting 6-year countdown to the historic 400th anniversary commemoration, Plymouth 400 has brand new events beginning in November. We will unveil the unprecedented Wampanoag exhibit, Captured 1614, at the Plymouth Public Library, and celebrate Illuminate 2014 in cooperation with America's Hometown Thanksgiving Celebration and Plymouth, England on November 20th. For information about these and other activities, visit PlymouthMA400.org.
Plymouth Cares is a community service project sponsored by Destination Plymouth and members of our local tourism community. We are committed to meeting the needs of people in the Plymouth area through direct service and social action. Monthly campaigns are intended to assist shelters, food pantries, schools, and nonprofits. In the month of November, we will be collecting blankets for local families and shelters. We thank you in advance for your support and participation.
Welcome back to Building Community. When we went to break, we were talking a little bit about what the town of Plymouth has been doing in collaboration to really help to improve our physical landscape, to be able to make it easier for all of us to get out there and be more physically active. Now, I understand through this collaboration, you've also been reaching out to area businesses and helping people to find ways to improve healthy eating. Tell me a little bit about the programs you've been working on with restaurants and markets.
Well, just from the hospital standpoint, our nutritionists, they understand sort of the science of nutrition just to a whole different level than does it taste good, is it easy to get, and if it has to be cooked, how easy. And they actually look at the nutritional value. When you buy something in the store and it says low calorie, people just go and tend to grab it because they figure it's better than something that doesn't say low calorie. Well, it could be that because it's loaded with salt, and it's got all sorts of different things that are in the nutrition label that you don't necessarily process through your head. The low calorie can actually be worse for you than something that isn't. So our nutritionists have actually gone out and worked with local markets, local restaurants, and they do analyses of exactly what the contents or compounds or what's in what they make and what they eat, and list out for consumers and make it sort of a good, better, best, or bad, good, best. Green, yellow,
it's
red.
All color coded, yes.
Yeah, the market at Pine Hills was the first one that we did this in, and Marcia Richards, who is the chief dietitian in the hospital in Healthy Plymouth, spent hours and hours working with them with what they sold as packaged goods, but also what they prepared as fresh-made take-home meals, etc. And it's been phenomenal. It's an education to everybody that what you choose directly translates to, sort of a healthier lifestyle. And we've had other markets follow suit. We've helped people set up farmers markets because we don't want to target individual populations. We want this to be a community activity. All ages, all constituents in the community. And again, we want Plymouth to have an identity as a healthy community. So you have to meet people where they are, and you have to help them where they live, and make it something that is sort of all for one.
One of the things you're starting to see now, too, is some of the other smaller stores, the little small grocery store, Tedeschi's and things, used to have packages of brownies or cookies or something. Now they're having fruits. You see bananas, apples. So even though they're not part of it, they're getting it and they're seeing it. And it's a wonderful thing to see.
And it really becomes contagious,
exactly,
as they say. When people are starting to think that way, and consumers start to ask the right questions, and it really is working with the businesses and working with the consumers. There's a whole other area that we haven't talked about yet, the workplace, and really helping employers to start to look at the environment they're creating. Is it an environment where people are sitting at their desks all day? What are some of the recommendations that are made for employers to be able to assess the health of their locations?
Well, we spend so many hours at work that when you think of how many hours you're awake during the day, at least 5 days a week, most of us are at work the majority of time. And we as employers, I think, have an obligation to help our employees lead healthier lives. So what we do at BI Deaconess Plymouth, for example, is we've put voluntary programs in place around smoking cessation, physical activity. We have what we call our Couch to 5K program. So the euphemistic couch potato. And we can get you up to 5K. Because sometimes you say, oh, we'll get you in a race. It can be a little intimidating. No, let's start slow. Let's gradually build it up. And I'll tell you, the camaraderie that builds, and just the pride that you see in people when they say, I did it. I actually did it. We've got a walking path, a mile-long walking path that we've constructed around the campus. I think I mentioned smoking cessation. We don't hire smokers at the hospital anymore. It's a smoke-free campus. I admit sometimes it's difficult to get the public to respect that, but we're a health organization, and that means it's our obligation to foster, promote, and educate, and we take that very seriously.
One of the things we've done at Plymouth Rehab, it's our 6th year, is we do a Biggest Loser contest, and it's based on the percentage of body weight you lose. And the top prize is anywhere from $500 to $800. So it's a great incentive for people to actually do that, and it's a 12-week period.
It engages people to work together as a group
absolutely.
and do something that's fun and
Absolutely.
And
Another thing we institute is a wellness program, so that it's very basic requirements. You need to just have a physical. There's a form, there's a physical you have to fill out and give to us, and then you have to participate in 2 programs that we'll offer in the year. And they're around dietary issues and exercise. And if you complete those 2 programs, and they're about a half hour, 45 minutes, at the end of the year, we'll give you a $100 bonus. So those are some easy things. Vending machines is another thing. Yep. I remember we had a program at the hospital. We had some students from the high school do some presentations, and one of them was, I believe it was from KBL Vending. They did a program on healthy snacks. And a lot of organizations have these vending machines. What sort of drinks can you put in there? What sort of snacks can you put in there that are more healthier, than the Reese's peanut butter cups and the Hershey's chocolate bars and things like that?
And again, it's making, the entire program talks about making the healthy choice the easy choice.
Exactly.
So working to make it easier for children, for parents to make healthy choices for their family. Now,
and I would just say, any employer in the region that would like some assistance in setting up a program, we would be happy to provide that assistance through the hospital. It's no charge. It's something that I think just makes it easier, a little less painful. Because sometimes when you get into this, employers think, oh, I don't want to be controlling. I don't, and it's, no, you're helping your employees. And in fact, you're helping their families, because these behaviors go home. And that's when it gets into the kids' routines. And because unfortunately, sometimes the unhealthy option has been the path of least resistance in the past. And that's what we're trying to get away from. And just if I could, along those lines, it doesn't make any difference how old you are, what condition you're in, anything. The first time you start making decisions around, I'm going to walk a little bit, or I'm going to have the apple instead of what, make those decisions no matter where you are in your life, and you will begin to go down that path of healthier behaviors and healthier choices. It benefits you. One of the things I learned from an oncologist once is they said, we don't know which cigarette causes cancer. So as soon as you can start cutting back and hopefully getting off them and going cold turkey, you'll feel better. And they're, the health problems that they cause are indisputable. And so anything you can do to make those incremental improvements is a plus.
And that was the question I was going to ask, because it can be so confusing. You talked earlier about, well, we'll be more likely to, if it says low calorie, we'll buy that. It's so confusing because there's so much marketing that goes into food, that goes into exercise, different equipment to purchase, supplements to take. You just don't know where to start. Any given day you can walk into the store and you're inundated by diet, low calorie, sugar-free, gluten-free. Am I supposed to eat sugar or not? Am I supposed to eat flour or not? Where does an individual start? If we want to head in the path of being healthy for ourselves, for our family, for our community, what are the things that we can do to educate ourselves?
I would say just a couple things is, again, if you have the opportunity to go to those markets where there are fresh fruits and vegetables, etc., the rule of thumb is the less that comes out of a package per meal is better. What's grown is simply a healthier choice than anything that's packaged, is a rule. As far as physical activity is concerned, you don't have to go out and join a gym. You don't have to go and buy the spandex and all of a sudden be a hard body. You just got to move. It's go for walks. If you have a dog, take the dog for a walk every morning, every afternoon, and every evening. The dog's going to like you a lot more, and you're just getting some exercise. If your kids have to go someplace, don't drive them. You know, tell them to get on their bicycle. Tell them to walk, you know, get out there a little bit earlier. So it's the little decisions that you make day to day that sort of add up to turning us into the couch potato society that we essentially have become.
And when you go to work too, if you're in a parking lot, big building, park further away and walk. If you're in a building that has an elevator, if you can use the stairs, use the stairs. It's, again, those behaviors that Peter's talking about that change the behavior of how we do things.
And be conscious.
Absolutely.
Have it in the front of your mind.
Right.
Now, Plymouth also has developed a website called Healthy Plymouth. I believe it's healthyplymouth.org. And there are a lot of links there that people can follow, and there's news every time something is coming out with a local farmer's market, or there's a new local store in the community that has been designated a healthy market. So it's a great resource, I think, for people to start getting more information and thinking about ways they can start to make individual changes that ultimately help to make community changes. And going back to looking at the community level, Beth Israel Deaconess Plymouth has been doing a lot of work in looking for new ways that you can reach out and collaborate with the community. I understand you have some news about something you've been working on for a long time to really help impact the health of people in this area.
Well, I would like to think that a hospital's focus is on the overall health and well-being of the community in which it's located. And I think we've done a pretty good job on the physical side of medicine over the years. I think we've done a very, very poor job on the behavioral side of medicine over the years. And I don't think I've been to a meeting outside of the walls of the institution in 5 years where behavioral health, substance abuse, opioid addictions, heroin, you know, you name it, hasn't come up as part of the equation and part of what ails this community. And we've been trying to figure out how to address it. Well, I'm thrilled to be able to announce that we got a $3.7 million grant from the state. It was awarded 2 days ago, and it's to set up a program around our most chronically complex patients and our behavioral health and substance abuse population. And we were going to do it anyhow, but in all candor, this allows us to do it sort of bigger, better, faster. And we are 100% committed to addressing the issue for and with the community and the various constituents. And I'm thrilled that we finally get to tackle this part of the problem in our community.
That is fantastic, and it's
Great
good news
news.
for everybody in this area to be able to have additional resources to fight that problem. And that's something we're going to be talking about on the show in the future as well. And I'd like to thank both of you for coming today, and I would love to invite both of you to come back and join us for future episodes because there is so much more that we can be talking about.
I'd love to.
It's a pleasure, and thank you very much.
Thank you.
Thank you. And thank you for joining us for this episode of Building Community. In our next episode, we're going to continue to explore the 7 dimensions of wellness by focusing on social wellness. For replay times, resources, and more information, visit PACTV.org. If you have show ideas, comments, or questions, email buildingcommunity@pactv.org. Thank you.